everyone. So this is Dr. Manasi from Department of Medicine, IMS PHU. So today I am going to tell you a bit about basics of diabetes. So diabetes is a chronic condition in which you have a raised glucose level. So glucose is derived from food we eat. So in diabetes, pancreas is no longer able to make insulin, and this leads to the increase in the blood glucose level in a patient of diabetes. So because insulin helps your body to regulate the blood glucose level, so insulin helps glucose pass from blood stream into the cells in the body to produce energy. All carbohydrate foods are broken down into the glucose in the blood. So when we talk about diabetes, there are three main types of diabetes. So type 1 diabetes, type 2 diabetes, and the third is gestational diabetes. So type 1 diabetes is a diabetes which can occur at any age. Before we used to tell that it is a diabetes of a younger people, but it has now been recognized that it can occur at any age. But yes, it is frequently seen in children and adolescent. When you have type 1 diabetes, your body produces very little amount of insulin, and that's why you need daily insulin injection to maintain blood glucose level under the control. Now coming to the type 2 diabetes, it is a condition in which you have a lesser amount of production of insulin in the body, as well as the insulin resistance. Your insulin is not working properly. So basically type 2 diabetes is seen in the adult population, and it counts from 90% of the cases of diabetes. When you have type 2 diabetes mellitus, your body doesn't make use of insulin. That is called insulin resistance. And several risk factors are associated with the type 2 diabetes, mainly the family history of the diabetes. So if your parents are diabetic, you are more likely to have type 2 diabetes. If you are overweight or obese, it is also a risk factor. Unhealthy diet, unhealthy lifestyle, and increasing age with the raised blood pressure. So these all are have seen to have been some association with the type 2 diabetes. The cornerstone for the treatment of type 2 diabetes is healthy lifestyle, maintaining a healthy weight, and a lot of physical activity. However, over most of the people of type 2 diabetes will require oral hypoglycemic drugs and or all insulin to keep their blood sugar in control. Now the third is the gestational diabetes. So it's a diabetes which usually occurs in a patient of during pregnancy. So it is associated with the complication to mother and child both. It usually disappears after pregnancy, but women affected and the children affected are at increased risk of developing type 2 diabetes later in life. Thank you.